So without further ado, I'm just going to discuss, I'll give you an overview of my presentation this morning. I'm going to talk about current health and safety authority, ergonomic risk management strategies and interventions. And this is kind of the agenda that I'll cover in the next 20-25 minutes. I'm going to talk about statistics because it's important for us to flag, that there is still an ongoing issue with the injuries, prevalence of musculoskeletal injuries and ill health being reported to the authority. Following on from that, I'll give just a brief reminder of the regulatory framework that governs the need for managing ergonomic risk in the workplace. I'll talk again then about some of the work we've done in construction, some of the issues we've come across, and some of the requirements we've placed on employers relating to addressing this risk in the construction sector. I'll then talk about work that we've been doing in the last 4 years in the healthcare sector. We've been doing a huge amount of work in the healthcare sector, looking at both aspects of ergonomics, inanimate manual handling, and also animate manual handling, which relates to patient handling. And that's an important area for us as well. So just to look at the statistics then of that sector, and then some of the interventions that we've developed in the healthcare sector. And then I'll just wrap up then with some examples of resources that we have, and introduced some of the resources that Alex is going to expand on. So if you look at the construction sector, 35% of all injuries reported to Health and Safety Authority in the construction sector over the period 2013 to 2022 resulted in musculoskeletal injury due to exposure to manual handling risk factors. Now, that's not the whole story, because we know, and I suppose the title of this webinar today is about managing risk exposure, because just because we're not getting incidents reported doesn't mean that there's still risk exposure, that people are still exposed to risk. And the nature of musculoskeletal injury and ill health is that the damage happens over time. So it may not be an acute injury. So you may not see in your statistics the level of risk exposure. And that's why it's so important to have a preventive management approach, a risk management approach, a risk assessment approach in relation to dealing with ergonomic risk management in the workplace. If we look at the general picture across other sectors, the ESRI published a report on our behalf back in 2013, and it showed that the risk of occupational ill health is greater in the agriculture, construction, transport and health sectors. There's a high risk of underreported injuries to the HSA among self-employed. The nature of musculoskeletal injury is that the damage is cumulative over time due to ongoing exposure to risk factors, including excessive force, repetition, sustained awkward posture. So with that in mind, we've been embarked on a number of interventions, which I've talked about before, to, I suppose, disseminate the importance of risk assessment, risk management, whether it be our workshops, whether it be new guidance, whether it be training internally of our own inspectors. But ultimately, it's getting down to the nitty-gritty of looking at what's happening in workplaces, what kind of work activities are carried out, what is the level of manual handling risk, and how is that being managed. So we look just at the legislation that governs, and I suppose that we have to, we're custodians of ensuring that this legislation is being, I suppose, complied with. We have the Act, the 2005 Safety, Health and Welfare at Work Act, and that talks a lot about safe systems of work, safe place of work, but it also has the hierarchy of principles of prevention, which talks about avoidance of risk, which talks about adapting work to the individual, which is another example of a definition for ergonomics. We have the manual handling of loads regulations. You have 2007, they're located in the Safety, Health and Welfare at Work General Application Regulations. We have the construction regulations, which again refer in some areas to duties of project supervisor for construction stage, and also project supervisor for design process to manage health risks as well as safety risks in construction projects. And then we also have the display screen equipment regulations, which were brought in 2007, originally transposed into Irish regulation in 1993. So the DSE regs and the manual handling regs are European regulation. And I'm going to talk briefly about the DSE regulation today, because there are plans. It's not a plan now, it's actually active at the moment. There is work going on to completely revamp and update that regulation. So I'll talk about that in a couple of minutes. So if we talk about the construction sector, just to give you an example, and it could be any sector here, because the same principles apply in terms of what we look for and what we observe. So this is an example of a construction issue that a colleague of mine came across. Subcontract workers were lifting large stone cladding units without any use of any kind of mechanical system to assist them. So some of the units that were being manually installed, weighed up to 60 kg. And it wasn't just, you can see there from the photo, the kind of thing we're talking about. It's not just the case here that there was just one lift where they lifted the cladding and that was it. What they have to do in these situations is they have to lift the cladding, they have to carry it, they have to place it against the face of a wall, away from the body for a period of time. That could be a minute or 2 minutes, sort of static, awkward posture, putting huge forces on the back. And this and we know the evidence would show us that these are very high risk exposures to physical ergonomic risks, and they will result in damage and injury to the back. So there's excessive force, sustained awkward postures. You may not see the injury straight away, but you will over time. And it's our job, and I suppose everybody's job, to be aware of these risk factors and address them in an effective way. So these work activities would result in a sustained large compressive forces on the trunk, sustained awkward posture, which puts the workers at risk of injury. So with that in mind, the inspector formed an opinion that this was an unsafe practice and issued a prohibition notice to cease the installation of the stone cladding. So as a result, myself and my colleague met with the project supervisor for construction stage and the subcontractors on this site. We went through the issues. We kind of flagged that there would be no planning had taken place regarding thinking about how this work activity is going to be carried out. There was no evidence that there was built into the design stage that, you know, that someone would think at the design stage, right, well, we're going to be putting cladding at the front of this building. How are we going to do it? And let's do it safely. So as a result of our intervention, they developed a method statement, which is a step-by-step method statement with clear instruction on how to install the cladding using appropriate mechanical aids. The PSCS came back to us with a plan of action, and they also acknowledged to us that the plan originally was to install over 1,000 cladding units manually on site. So you can see that would have, you know, created a significant hazard for the workers involved in that work activity. So the manual installation of the cladding ceased and the PN was issued. A new system of installation of cladding was put in place using that lift you can see there in the photo, the vacuum lift. And it was also, more importantly, a commitment to address in the future to incorporate the use of appropriate evidence-based risk assessment tools for managing ergonomic risks in the future. So that's one thing that we're conscious of as well. If we come across a situation, we like to meet with the designers, the architects, the construction, the PSCS, the subcontractors, and let them know, look, this is what we're looking for. This is the quality of the standard we're looking for in managing these risks. So in this example here, these, you know, with reference to the MAC tool, which we've talked about a lot over the last number of years, if we just take an example of the risk factors, you can see load, weight, and frequency would be very high level of risk. Hand distance from the lower back, high level of risk. Vertical lift region, high level of risk. And grip on load, high level risk. So, you know, there's your examples. There's your KPIs. There are key performance indicators that there is risk exposure. And aside from having incident data or reported injuries, this is the kind of thing that really we need to try and manage in the workplace setting. And the drive should be to get these key performance indicators reduced down to green and ambers, and that's ultimately the goal, and that's ultimately the objective of the guidance and the legislation. So our inspectors have been involved over the last couple of weeks doing an inspection campaign in the construction sector, and these are some of the things they would have been looking for: load weight data for planned installation of large loads on site, evidence that any kind of risk assessment and of the work activity. And these risk assessments would have to be good quality. They would have to have examples of how they assess risk, how they quantified risk. But they would also look for, more importantly, evidence of method statements with evidence that measures have been put in place to mitigate risk, i.e. the use of appropriate mechanical aids or better organization of work activities to mitigate risk. So other things that, that we have kind of advocated as well, see, these are typical kinds of questions that we could ask of contractors and PSCS. Have you identified the range of loads that are going to be installed on site, whether it's cladding, glazing, fire doors, plasterboard? The same thing applies in the manufacturing sector, the transport sector. When I go to a manufacturing site of my colleagues, the first thing I'll ask about is the flow process, the different work activities that go on in that factory. And then I would ask about, well, within that factory, within those flow processes, where's the human interaction in those those areas, and what kind of manual handling work activities are carried out, and what is your risk management approach? What is your policy around risk management for ergonomics? So in the construction sector, the same thing, what are you going to install on site? Have they requested subcontractors to provide risk assessment? Because the reality is there's a lot of subcontractors working on construction projects, and they need to have a knowledge of how to manage and assess risk as well, because ultimately they're the people that will be delegated by the PSCS to install whether cladding or glazing or whatever that be, albeit they would have a very important supervision role. Have subcontractors access to load weight data? It's interesting though, some of the projects, some of the referrals that I've been involved with colleague inspectors, and when you ask for load weight information, it's not available. And for me, that's a big red flag, because if you don't have that information, how can you demonstrate that you're quantifying risk to eliminate exposure to excessive force, awkward postures? We also asked them to demonstrate how they're assessing these risks, what is their planned installation, and have they considered use of mechanical aids. So these are just kind of like an aid memoir, but it's useful for people as well to take account of this, because whether it's a construction project or any other kind of project and in other sectors, these are the kind of questions that you should be asking yourself. If I just want to move on briefly then to work we've done in the healthcare sector, this is just a statistic for non-fatal incidents over the period 2014 to 2023 that was produced by our data management team in the HSA. You can see there that up to 18,606 incidents were reported over that period, over that 9-10-year period, which is a significant number of incidents. If we just kind of focus in on a particular year, we can see that in 2022, 40% of all injuries reported to the HSA in the health and social care sector resulted in musculoskeletal injury due to exposure to manual handling risk factors. So again, the evidence is there, the rationale is there as to why we need to focus on addressing these issues. The kind of thing we do when we go to, we've done a lot of inspections in the hospital sector, looking at inanimate manual handling, and this is looking at, underlying to them our risk management approach, that our focus is on work activities. Our focus is on looking at the human element in relation to those work activities. Our focus is on understanding the different types of functional areas, different types of work areas that there are in hospitals. And as you delve in and forensically look at this sector, you can see there's lots of different areas where potentially there could be ergonomic risk. For example, you can see there some of the areas that we cover on the inspections. We go to radiology, we go to pharmacy, where they dispense, pharmacy medication throughout the hospitals, but also sometimes to external smaller hospitals. We have catering, kitchen areas. We have laundry. We have some hospitals that actually have laundries. We have records management, medical records management. So there's a lot of retrieval of records. We have portering for moving beds, trolleys, stores area, and maintenance. And maintenance is another area that ergonomics needs to address, particularly in plant rooms, the movement and handling of pumps and large loads. So there's a whole range of areas in the healthcare sector, in the hospital sector, and that could be applied anywhere. Like, as I said earlier about manufacturing, you look at the flow process. So we do, this is how our inspection goes. We flag issues as we go along. We do a wrap up, and then there's a follow-up report of inspection. And the ultimate objective is to continue to address and improve the risk reduction in these sectors. So some of the examples of interventions that we've been working with hospitals and healthcare. And hospitals that we visited are not just HSE hospitals. We also look at private hospitals. We also look at the voluntary hospitals. So things that some of the interventions that have happened as a result of our own involvement in these inspections are, for example, bespoke bed mover solutions. So very, very innovative bespoke solutions for moving beds. And in some hospitals, these bed movers can be used by nursing staff, by clinical staff. So that it's very, very effective solution, particularly when you're pulling large beds or trolleys over long distances, along wards, up wards with gradients. If you have to move a bed into a very tight space, they're really well designed. And the bespoke solution is key to that because it addresses site-specific aspects. Because every hospital is different, the infrastructure of every hospital is different. Other hospitals have introduced electric tugs for moving of laundry trolleys and other stores trolleys as well. Spring-loaded trolleys been used in laundry prep area, which ensure that the laundry is always at kind of knee to waist height. So that's a clever solution as well, because the people working in that area, they work hard. So the idea is ultimately to ensure that there's less fatigue and less chance of injury by introducing these kind of innovations. And then we things like, for example, pot wash areas in kitchens being improved, the layout and flow of product, I suppose utensils and that have to be washed. Rejigging the whole area so there's less double handling, there's better postures, height adjustable desks in radiology. That's kind of an example of some of the ergonomic issues that we've seen addressed. Even the space to get from one side of a trolley to another side in carrying out an ultrasound. So they're just some examples of the drive to develop interventions. So just before I wrap up, I just want to mention the Display Screen Equipment Directive. As I said, this was brought into Irish law in 1993. Ultimately, it governs the management of risk related to people who work at computers habitually over the day. And as in that situation, there is a requirement that those people have their workstation assessed by a competent assessor who is independent of the employee who's getting the assessment carried out. We did flag to the EU about 6-7 years ago that we felt that this directive, and we weren't the only ones, other member states flagged it as well, that this directive needed a major revamp, particularly to take account of new types of technology, to take account of new ways of working. For example, we saw in the last 3-4 years where remote working came front and center, and we had to respond to that in the HSA with new guidance on working from home. Also mobile working, different types of work scenarios. Also to take account of new types of office equipment. There's been a lot of discussion around sit-stand workstations as well. But also the importance of dynamic work posture so that people are not sitting for long periods of time, so that work is planned in such a way that you're not sitting at Teams meetings for hours on end. So the work is ongoing. We've been feeding in. There has been consultation process across the EU. We've been given feedback and our opinions on the updates. So the work is continuing to happen on that. There's ongoing consultation, but there still is no draft legislation at this time at EU level. So we will keep an eye on that and we will update as it develops further. So just finally, this is, one of the resources, one of the reasons we had this webinar today is because I've done some work with Alex and her colleagues in the Education Support Unit. And I felt we had done a lot of workshops over the last number of years focusing on risk assessment methodologies. And with that in mind, we decided we would develop a simple 20-25 minute introduction to Ergonomic Risk Assessment module, which I think was released about a year ago. And Alex will be talking to that as well. And I should also give you some indications of the numbers that have signed up for that. This is something that's free to use. It's a good awareness training program. It doesn't mean you're fully competent on doing risk assessment, but it certainly gives you an awareness of what it's all about. And certainly you can then look at other types of training, further training on using these tools. But ultimately, this information is key. This is very relevant information for managing ergonomic risk in your workplace. And, Alex will go through that. It talks about the risk assessment tools, the MAC, RAP, and ART, but more importantly, it talks about the scoring system that we use and the 5-step risk assessment methodology. It goes through that step by step. Just yesterday, I was in a manufacturing company down the country, and they are doing a lot of work looking at their different processes, and they've actually consulted with external contractors to assist them. But interestingly enough, one of the interesting things they said was that what they've learned is the importance of actually forensically looking at the work activities that are carried out by staff in the workplace to get a better understanding of the nature of the work they're doing, but also the nature of risk that they're being exposed to. And ultimately, this 5-step risk assessment methodology, that is the objective of that. It is a disciplined step-by-step approach to allow you to forensically collect information on how the job is carried out, what kind of technical information is relevant, and then using the appropriate relevant evidence-based risk assessment methodology. This is what we were advocating for the last number of years. We're seeing more examples of it. We need to see a lot more examples of applied in workplace settings. Finally, there's some guidance there, which a lot of this was already on the registration page on the day of on the event website. So that's really it for me. Thank you very much for listening. What I'd like to do now is invite my colleague Alex. Alex is going to present her presentation on the resources within the HSA that kind of look at areas of ergonomics. So I'll hand over to you, Alex, for the next 15-20 minutes. Thank you very much.
Thanks a million, Frank. Just going to share my screen now with everybody. Now, thanks again, Frank, and thanks to absolutely everybody for joining us today. My name is Alex, and I work in the Enterprise and Employee Supports unit in our Occupational Health division here in the Authority. And I luckily get to work with the education side of the house. So we do a lot of our educational promotional resources for future workers and learners and really everyone in employment. So today I'm going to talk to you about HSA Learning primarily, so the ergonomics resources that we have available on our online platform. And then I'm going to so we'll talk about HSA Learning first, just a general overview of the platform itself. And then I'm going to go into the courses that we have that touch on the ergonomics topic. And then finally, we have a group manager facility that allows for employers and lecturers to sign up multiple people to do a course. So I'll go through that facility because it's a really great feature that we have on the platform. So this is HSA Learning, hsalearning.ie. It is an educational platform consisting of a range of free online health and safety courses. All of the courses have been developed by ourselves, the Health and Safety Authority, with the aim of improving awareness of workplace safety, health and welfare. The self-directed courses give learners a flexibility to choose a course and to study at their own time and at their own pace. So should you need to stop mid a course, the system will save your progress and you can leave and come back and you will still be at a different date. You'll still be in the same, your course will be saved for you. So again, they're all free of charge. They're accessible 24/7. So that allows that flexibility. You can register online, and once you have an account, you can register for any of the courses that we have available on it. There's a browsing section on the homepage of hsalearning.ie that allows you to easily search for a course relevant to you, or you can go to the courses drop-down menu that we have up in the navy tab at the top. Here you can scroll through the sector of employment, or you can select the topic that you're looking for. And in this, it would be the ergonomics topic that would bring you to the course that Frank was just talking about. When you complete a course on HSA Learning, after successful completion, learners can download a certificate of completion for the course. So that's just to note, the certificate is a confirmation that you have completed an awareness raising course. It's not a qualification, but may be used for training record purposes in work or in your education. So I invite you, if you haven't used our platform before, please have a look online and see if any of the courses interest you. And again, registration is free, and have a browse around and have a look. So this is the course that Frank was just talking about, the Introduction to an Ergonomic Risk Assessment course. We were absolutely delighted to launch this last year. I think it was late last summer that the course went live. So we had, just by the end of 2023, we had over 400 people complete the course. And this year to date, we've had over 600 people complete the course. So the guts of over 1,000 since its launch, which is a testament to Frank and my colleague Brenda for developing the course. It really is. It's a brilliant informational course, creating awareness on the topic. And the course is CPD approved by Engineers Ireland as well, which is a great plus. So please, if you haven't heard of the course before, please sign up and have a look at it. The course, it does have an emphasis on the 5-step risk assessment process that Frank was just talking about. It's suitable for practitioners, including managers, supervisors, and safety officers, suitable for all occupational health professionals, basically, who may be assessing work activities which involve manual handling and or repetitive tasks involving the upper limbs. The course takes approximately around 20 to 25 minutes that Frank has just said to you. The learning outcomes, I'll just even go through them. I can read them out real quickly. The learning outcomes are understand the meaning of ergonomics and how it relates to manual handling, work activities, and or repetitive tasks involving upper limbs. Should be at the end of the course also understand why ergonomic risk factors must be managed and understand the ergonomic risk factors that impact on musculoskeletal health. Recognize risk assessment tools that can be used to assess ergonomic risk and apply a 5-step ergonomic risk assessment process for assessing work activities. So I'll just show you an example of it. This is a screen grab of what inside the course looks like after you enroll. So you would register for HSA Learning first, and then you would click enroll onto the course when you find it within the topic and the topics page. So the course is divided into 5 lessons. We have an introduction, then it goes into what is ergonomics, and then managing ergonomic risk factors, risk assessment tools for assessing ergonomic risk factors, and then applying a 5-step risk assessment process. So this is all followed by the assessment. And then after you complete your assessment, there's a further information and conclusion sections that will have further links to other resources that would be of the same topic and suitable for anyone who's done it. Now, and I'll just show you another slide of it. This is an example of we have flip charts throughout the course, which for this is the 5-step process, just an example here. When you click on the flip charts or the flip cards, it'll give you more detail about the actual, so say, for example, if step 1 is task description, they'll give you more information on what that involves. We do have an example provided in the course, a workplace example to see how this is implemented, this step. And then we also have further detailed guidance on using the MAC, RAP and ART tools, which is also provided in the further section at the end of the course. So it's a really, really beneficial course for ergonomics. And like I've said to you, it's performing really well on the platform. We're delighted to promote it when we go out at events and everything. And it does seem to be getting really great feedback. So, and thank you to anyone who has already done our course. We are always great to hear some more feedback on it. We have other courses throughout HSA Learning that do touch on the topic of ergonomics. We have our Workplace Safety, Health and Welfare Induction course. This is a course that was developed with our Atlantic Technological University, Sligo, ATU. This has 8 units in total, but Unit 4 is the one that focuses on ergonomics that may be of interest. Now, Unit 1 and Unit 2 are compulsory, so they have to be done before you can access any of the other 6 units. So just a reminder, Unit 1 and 2 have to be done before you can get onto the ergonomics one. As this is a course that's been developed with ATU, it sits on ATU's platform. So the group manager facility, I'm afraid, is not available for this course. There is, however, digital badges to be awarded per unit completed for the course. And also on our end of the site, there is also certificates too, but just the group manager facility isn't available, like the rest of our courses that are on HSA Learning. So we have the Occupational Safety and Health when Remote Working course on HSA Learning. This focuses primarily on the display screen equipment risk assessment. Section 4 has the assessment checklist, which includes a workstation assessment with, on DSE and work equipment. So it's just, again, it's another awareness raising course to really to ensure that everyone has adequate controls in place to reduce the risk of musculoskeletal disorders. And I'll show you, we have another one, which is short courses on workplace safety. These have been derived from our larger course, with the one with ATU, the Workplace Safety, Health and Welfare Induction course. So these are just shorter versions of these. The group manager is available for these courses. We do in part 4, manual handling and ergonomics are included in that one. So, and we are also delighted these courses have all been translated into Ukrainian. Should you have any Ukrainian colleagues and all, please invite them to sign up for these. All of them have been translated for them. Now, and I'm just going to go through our group manager facility. Sorry, you've heard me mention it there a few times. This is it's a facility available for if you're organizing a group to take on a course on HSA Learning. So you could be an employer, a manager, teacher, or a lecturer, for example, and who can register a group. So you have to register for HSA Learning, just a quick reminder, for before you can enroll a group onto it. So please make sure you are registered yourself. Then you can enroll to the course that you want your group to go onto. And when you are enrolled in that group, you'll be able to see on the left-hand side, I don't know if my cursor is showing on the screen, but there's this little box on the left-hand side called HSA Group Manager with the little white star in the orange box. So you can create your group here. When you create your group, you'll be offered, so you can click a name if you want to say it's class 1, class 2, or if you have a specific group for it. Now, before you make the group, please make sure you have the consent, because you'll be uploading someone's details to the platform. So please just make sure you have consent for that. It would be their email address that you're using. The box below that we have is emails, it's very case sensitive. So please make sure when you're typing them in, not to use any extra digits or any spaces after each email. Just put them in a line and without any extra commas or spaces, because they won't unfortunately upload after that. But when you have registered, the system is automatically going to email everyone that's on your list with a link that's going to invite them to take part in the course. And if you have been invited to enroll as part of taking the course, just know that your group administrator, the person who has created the group, can see your name and whether you have completed the course or not. So a lot of employers are really interested in this. And again, it's great health and safety awareness for your staff or your team members or your students, and just to get them thinking a little bit more of occupational health and safety, in particular the ergonomics risk factors. As Frank was going through there, we can see how prevalent it is throughout all workplaces, really. So would be great to increase awareness as much as we can. So I think I kind of went through very, very briefly. We do have a technical support available for HSA Learning.ie. So you can contact our HSA team on elearning@hsa.ie, or we have our contact center as well. Contact us at hsa.ie. But we also have our providers of the platform who offer great technical support, HSA support at innovation.ie. Just some simple issue or something that your certificate's not being downloaded or anything, but we are there should you need any help. And thank you so much and best of luck, and please do use HSA Learning.ie. HSA.ie, the website does have further information, but for the time being, the courses are all on our other platform.